Welcome to Toward Racial Justice. I'm Charles Ellison, host of Reality Check on WURD, and your host for this conversation series addressing systemic racism and injustice in central Pennsylvania and beyond. This discussion today is on the intersection of race and the LGBTQ community and is being presented by WITF Public Media in Harrisburg in partnership with the LGBT Center of Central Pennsylvania. So welcome. Good to see everyone. Can't wait to have this discussion and really appreciate everyone's time today to watch the insights and to get some thoughts from our panelists. 42% of LGBTQ adults in the United States identify as people of color. And as the national discussion around racial equality grows, many individuals are facing challenging conversations with people who are uninformed about race, identity, or the intersection of both. During this discussion, we'll examine some of the needs and challenges faced by LGBTQ communities of color, such as discrimination in the workforce, within the LGBTQ community itself, and address some of the unique obstacles LGBTQ youth of color are dealing with. We invite you to share your personal experiences, also to ask questions, give comments, talk to us, and we'll try to address it during this conversation. Email us at discuss@witf.org, or you can share your story using hashtag RacialJusticePA on social media. Let's go ahead and get the conversation started. I'll introduce the panelists. We have Amanda Carter, Site Director at Glow Harrisburg, LGBT Center of Central PA in Harrisburg. Carter, how are you doing? Stephen Jiwanmal, who is Communications Manager at the Bradbury Sullivan LGBT Community Center in Allentown, PA, also joins us. Hi there, Stephen. Anna Machado is Director of Programs at Centerlink, the community of LGBT centers of Orlando, Florida. Also joining us is Bryce Williams, Medical Case Manager at Keystone Rural Health Center based in the Chambersburg area. So Anna, Bryce, Anna, thanks for joining us from Florida as well. Really appreciate it. Let's get that conversation going. And so can I first ask this? I just want to kind of throw this out here to the panel. I am real curious about it because there's been this big sort of shift, a paradigm shift in how we have discussions about the LGBTQ community, and it deals with pronouns. And, you know, talk about the pronouns that each of you are using right now. You see it on the screen in your ID boxes. Talk about why that's important, because I see that a lot of us see that now as a movement and a big paradigm shift, and but I don't think most of us really truly understand it yet. Anybody can jump in on that question. Let's start with you, Anna. I'll start with you down in Florida.
I knew that was going to happen. Hi, everybody. Well, I mean, I think that the conversation really about pronouns is a movement, really, to take us away from the binary, right? We understand gender to be one of two, and that's not the reality for a lot of us in the world, right? And so really this movement to include pronouns is to create knowledge and about the importance of realizing that we're all human, right? Regardless of whether or not you see yourself as part of that binary. And as a start of a conversation, I think that there's a lot of pushback because of not understanding what the movement is about and what it means for folks. And that folks that don't necessarily consider themselves part of that binary have been around forever. This is not something new, right? This is not something that's happening right now. It's just that we are now coming to the understanding that folks live outside of the binary. And that's what I'll say on that, so that some of the panelists can
thank you for that, because I feel like, especially for a discussion like this, or any discussion really, language is important. You know, the messaging is important, and how we're also creating definitions. And I'm sorry, Ana Machado, excuse me, I want to make sure I'm pronouncing that correctly. But I just, speaking of language, but Carter, would love to get your thoughts on that too. You know, the importance of language when we're having discussions like this, and they're not just discussions; they're important because at some point, you know, these movements have to make change.
Sure, I agree with everything Anna just said. I just wanted to add that it's also a safety thing. You know what I mean? We're showing our pronouns, we're displaying them when we introduce ourselves. We say, "Hey, I'm Carter. Are you she, her pronouns?" But that is almost a signal for our trans family to know that you're in a safe space. You know, we're going to respect and honor your pronouns. We're going to affirm you. Things like that, and use of gender neutral language just kind of make it a lot safer for trans and non-binary individuals that for a long time, most times, oftentimes are completely overlooked.
Mm-hmm. Yeah, Stephen, language can be, you know, very productive. It can enlighten us. As Carter's saying, it can also keep us safe. But yeah, you're right. If we're not careful, it could be dangerous. Your thoughts on that, Stephen? I'm just
Yeah,
curious.
I mean, I serve as communications manager for an LGBTQ organization, so I know how important words are to not just our own organization, but outwardly as well. You know, inclusivity and diversity have always been important aspects of any organization or business, and this is a small request. It's something really simple, but really important too. I had a friend messaged me the other day and was asking how important it was for straight people to use the pronouns. And I was quick to say it's not just a straight thing. I identify as gay and cisgender, but I use he, him pronouns, which is the same as a straight cisgender person. So pronouns just identify who you are. It's as basic as your name. You know, a friend had mentioned to me, you know, we share what we ate for dinner on social media. We share, you know, where we're going. You know, sharing your pronouns is even more basic than that. And so making sure that you share that avoids assuming things, avoids misgendering someone, avoids, you know, potential conflict. So I think that's
Right.
part of the reason why pronouns are really important for everyone.
Hmm. Hmm. Yeah, Bryce, offer your thoughts on this. You know, especially before I get into that conversation about identity and especially the variations between, you know, BIPOC folks, LGBTQ folks, individuals, coming from, you know, one community and perspective, and comparisons to like their white counterparts in those same communities. But Bryce, real quick, I did want to get your thoughts on kind of this discussion we're having now, which I do find fascinating.
Most definitely. So, thank you. My name is Bryce. My pronouns are he, him, she, her. And it's very important to be able to just discuss the fact that there is more than the binary. So, whenever we think of binary, we think of male and female, and then we think that that's it. But that is really putting putting a barrier for individuals who are genderqueer, who are non-binary, who are agender. And on top of that, when we talk about sex as well, we think, once again, oh, it's male or female. But then that leaves individuals who are intersex out of the conversation as well. Intersex is a term that's is the politically correct term for what they would say in the olden days, hermaphrodite. So that leaves them out of the conversation completely. All you need to know about sex is that it's made up of a bunch of X's and Y's. And, you know, if you have, you know, two X's, great. If you have an X and a Y, wonderful. But there are some individuals who have great variations of that. And it's the same thing with gender. Last thing I want to say about this is you would go to a person who has a dog and say, oh, is it a boy or a girl? You do the same thing with anyone who you're meeting in public. You say the same thing about that with a baby. Oh, is it a little boy or a little girl? What are the pronouns of this baby? So I don't misgender this child. Mm-hmm. And it's very easy to do with another human being as well, another adult as well. Right. Or another human being.
Good point. So Anna, going back to you, just going around the table here, those contrasts between BIPOC individuals, Black, Indigenous, people of color, individuals within the LGBTQ community who've come out, and also white LGBTQ individuals. There's some very sharp differences, not just in terms of how we look, but also in terms of the experiences.
Right. So Give me a little bit more. What's the question on this? I mean, there's definitely some differences.
Yeah, there's definitely differences, right? But and let's talk about it in terms of the issues, in terms of just there is an assumption that okay, we have this LGBTQ community and it's just one big sort of tent and everyone under it is the same. I think that there is that common sort of misconception of that, right? And so, but it's much more complicated than that, and there are tensions. And yeah, like white LGBTQ folks can be just as racist as white straight folks.
I mean, there's definitely diversity, right? I mean, diversity is so large. I mean, we can talk about race, ethnicity, we can talk about gender, we can talk about sexual orientation, right. and we live within those intersectionalities of all of those things, right? So that there is no one fits all ever. Again, I'm going to refer to my shirt of we're all human, but we're all different in so many respects. And specifically when we're talking about BIPOC LGBTQ folks and the white counterpart, there's so many differences there as well in experience, right? In life experience, in access, in so many things that impact our lives, right? And I think that part of the conversation really is about talking about being able to look at our individual privileges, regardless of where you live in the intersection, right? Or where you are, and being able to come to the understanding of your own privileges, whether you're white, whether you're brown, whether you're Black, and thinking about what facilitates those privileges. There are certain things that we can't choose as human beings. We don't choose where we are born, what economic background we're born into. There's so what language you speak, what race you are. There's so many pieces that you can't choose, right? But there are systematic and institutionalized pieces that make it more difficult for brown and Black folks, regardless of your sexual orientation and gender identity, to come to sort of the conversation here, right? Justice, to equality. And we typically look at equality without looking at equity.
Yeah.
And that's really what the conversation should focus. It's about equity. So I'm going to leave it there and open it up.
I'm glad you mentioned that too, because there is a big difference between equality and equity. And I'm sort of paraphrasing here what recently the chair of the Pennsylvania Legislative Black Caucus was telling me about that just the other day when I was having a conversation with her on Word. And she was saying equality is when we're trying to, we're trying to have the same things or achieve the same goals as everyone else, or as like our white counterparts, right? We're trying to achieve, like parity, right? Equity is when we get completely what we need, like the things we need, the resources we need, right? So it's not just about like, oh, okay, I want to go to the same school or be in the same school district as like my white friends or white colleagues. No, I want to make sure that I have full access to adequate schools, to totally, completely funded schools, and I'm getting the best education possible. And that's equity. But Carter, jump in here too, and then talk about this within the Pennsylvania context, about those challenges that BIPOC LGBTQ individuals have to deal with, particularly in a region like Central Pennsylvania. I mean, we already have like serious challenges and issues and, feelings of alienation and isolation when you're in Central PA. It's not like Philly. Philly, it's a lot of Black folks, everywhere, but and just to saying this as someone who grew up in Philadelphia, Central PA, those communities have to be tight knit, those Black, brown communities. But it can be even more challenging, or talk about it, when you're a person within your BIPOC and your LGBTQ.
Right. So, I mean, I can speak to a Black American experience in Central Pennsylvania, but I don't necessarily feel comfortable talking about a BIPOC experience. It sounds like a whole lot of people and a lot of different
No,
experience.
please do. Yeah, no.
Yeah, no, for
Thank
sure.
you. Thank
But
you for that too. Yeah, because there's even like differences and different perspectives and different tensions within that umbrella.
for sure. But yeah, Central Pennsylvania, yeah, this is a different place. It's a special place. And Harrisburg is a small town, and it can be uncomfortable and dangerous for queer and trans people of color here. So here's the thing, we do have supportive systems in place, which is awesome. We have GLOW, which is new, but still awesome. And we have people that have been in the community, bringing people in that need community, creating family and establishing family where it doesn't exist otherwise. So those systems, even though they may be few and far between, they exist, and that's fantastic. On the flip side, a lot of us are connected to the Black church, and there's a whole lot of stigma there. And some of us have families that kick us out, don't associate with us anymore when they when we are living our authentic lives. And that's incredibly unfortunate. It's very harmful. And I see that as some of the additional stigma that Black and brown people that identify as LGBTQ plus are experiencing. So yes, like Harrisburg has a wild rate of homelessness. And, a lot of our Black and brown young people are in schools that are not the best schools. We have a lot of things working against us, but tackling, like adding on those LGBTQ plus identities can make things a lot more difficult than they already are, which it makes me think of like the question about coming out. I think a lot of times parents of color, Black parents specifically, when they find out that their child is queer, trans, it's maybe less anxiety inducing for the child than it is for the parent, because the parent is already stressed out knowing that they have brought a Black child into this environment. That has, a lot with it. But then to find out that, okay, my child also identifies as gay or trans or lesbian, that I think that's a large part of the bad reaction that we sometimes hear about, just immense fear.
Bryce, you were raising your finger. And so, talk more about that, expound on that, especially where you are, and also how that, like what Carter was just describing, right? That anxiety that is expressed by the anxiety and the animus too, that's expressed from families, from parents, because it's like, oh, well, you're already Black. Now you're adding this, like as if you made a choice to add that layer of you didn't make a choice. That's who you are, but you raised your finger. You were having a reaction to that.
Yeah, I had raised my finger whenever Carter was talking about the Black church. I co-facilitate a support group for BIPOC individuals who are queer that's based out of York. And I talked about that actually at the last meeting. And every single person who was there had an experience of religious trauma, being told that, well, I'll always love you, but you know that you're going to hell because that's a sin. Or not being told that I'll love you and being sent to conversion therapy. And sometimes conversion therapy looks a little different from, white conversion therapy versus Black conversion therapy. At Black conversion therapy, you're being, you're taken to the church, people pray over you, they're speaking in tongues, for many individuals who experience that. Versus white conversion therapy, where oftentimes you're sent away, and once again, you are kind of brainwashed to believe that you're not straight, or you're not gay, or you're not trans, or whatever have you. But very much so, religious trauma is so deeply embedded into the Black queer experience, at least. And it's awful. It really is, because it leaves us traumatized. It leaves us with PTSD, and PTSD that we never address because of the systemic issues in the world in general. If you can't afford, if you can barely afford to pay for your house, how are you going to be able to afford to pay for therapy?
Yeah, can I just add, like, the energy there is pick a struggle. You know what I mean?
Yes.
Yeah, it's like, okay, you want to bring a lot of attention to yourself. You know what I mean? Like, pick a struggle, please.
I've heard that. Yes, I have heard that. Pick a struggle. Like, are you gay or are you black? Like, what?
Mhm.
How can it be a choice?
Mm-hmm.
And for black women who are queer, triple homicide. Like, wow, geez, Louises. You're black, you're a woman, and you're queer.
Hey, Stephen, I just want you to jump in real quick before we go into just a quick break. But how do you, just your thoughts, Stephen, on how you transition from the interpersonal struggles, right, to then the broader community-wide struggles, and then translating those interpersonal struggles into activist group organizing, right? So, like, what's that process like? Well, I would love to get your perspective on what that process is like for you, Stephen.
I actually wanted to go back to something that
Sure, go ahead.
about the religious trauma.
Please.
I know it's very much a factor in the Black church. It's also a factor in the brown church too. I mean, my own personal experience, I grew up in the church. My grandfather was my pastor growing up. When I came out, I also went to conversion therapy. It was very traumatizing. And it's just something that stays with you. It took me a while to even consider therapy because it was just never considered an option growing up until I grew up and spoke to other people who recommended therapy. So I finally started therapy the start of this year because I had affordable health insurance. Thanks, Bradbury Sullivan. But it was really important in kind of deconstructing what I was going through. So I just wanted to touch on that because I think that's a really important element too. I think for BIPOC folks, the element of faith is so uniquely tied to who we are. And sometimes we're born into that. And that's just an extra layer that we have to kind of get through.
We're going to, just hold those thoughts. I just want to remind everyone, the audience that's watching, this is Toward Racial Justice. I'm Charles Ellison. And we invite you to share your personal experiences, any questions that you might have, also, just to comment on what you're hearing right now by sending emails to discuss@witf.org, or you can join us on social media. We got a social media team on standby. They are retweeting clips, quotes from this conversation, #RacialJusticePA. I'm on Twitter primarily, so that's all I'm on for the most part, Twitter. So #RacialJusticePA. Even if you'd like to share your story too. And right now we're talking with you. Just now heard Stephen Jiwanmal. He is communications manager at Bradbury Sullivan LGBT Community Center in Allentown, PA. Before that was Bryce Williams, medical case manager at Keystone Rural Health Center based in Chambersburg. And then we had Amanda Carter, site director, Glow Harrisburg LGBT Center of Central PA in Harrisburg. And Ana Machado is director of programs at Centerlink, the community of LGBT centers in Orlando, Florida, and Central Florida. And so they're all joining us here for our discussion on being BIPOC and LGBTQ, the intersection of race, racism, and the LGBTQ experience and community. We're here live on WITF Public Media. So, I was real curious, something, Stephen, that you were saying, where you were at a moment where you were saying, hey, I had a hesitation to pursue your traditional therapy or therapy that wasn't hostile, like what you went through, that conversion therapy. And then you said something, real quick, and I want to get deeply into kind of the policy issues around this. Thank you for that health insurance. If my health insurance pays for it, is that a struggle? Like, just getting health insurance for challenges or issues like mental health issues that are uniquely LGBTQ. Is that a challenge? Let me go to Bryce. I see you shaking your head on that.
Very much so, yes. I mean, it's so expensive first of all, if you're offered insurance through your employer, and this is a struggle for anyone who has employer insurance, private insurance, how much is it going to cost out of your paycheck every single month or every single paycheck? And then as well as that, if you have the opportunity to have your insurance paid for through, through your employer, and you don't have anything coming out of your paycheck, how much is your deductible going to be? And can you afford that? On top of that, if you have Medicaid, say that you can afford, you qualify for Medicaid. How many therapists are in your area who understand the BIPOC or the Black, Indigenous, or experiences of people of color?
Yeah.
And on top of that, how many therapists are going to take your insurance who are going to understand the queer experience? Because the thing is, I work with a lot of people who are Black and queer, and all they want to see is a therapist of color who will understand them.
Uh-huh.
There's no one in this area. No one in this area who will be able to understand them and who will be able to say, I get where you're coming from. 9 times out of 10, they're being told, well, that's just your family, so you have to deal with what you have to do. No, I want to speak about the traumas that I've been through, the experiences that I've had as a queer individual, and why it shaped my life and made me act the way that I do, or made me the person who I am today.
Mm-hmm.
But no one's equipped with the tools to do that, at least not here in Central PA. And Chambersburg, I'll say.
Anna, I want to ask, because there was a question I was going to earlier. I was asking Stephen. I want you all to sort of reflect on it. Those interpersonal experiences that you all went through, and Anna, I'll start with you on this question. Did that give you the kind of energy that you needed to translate that into the activist group organizing, the group mobilization that you all are involved in on some level? Anna?
Yes,
and what was that? Was there a process that you went through, or sort of a shift of sorts? Describe that kind of process that you went through, that transition you went through, and getting from the interpersonal to the more kind of community-based action or activity.
Okay. And I do want to go to, before I answer your question, I want to go back to something Bryce was saying.
Sure.
About healthcare and the lack of providers that are culturally sensitive. If you, on top of it, belong to the trans community, maybe that LGBT provider may not be, equipped to then see you and treat your issues, right? Whether they be medical, mental health, whatever, right? Or maybe not even the provider. If the medical staff and the system is not equipped to do it, those folks may also not be seeking that help, right? Because of fear of discrimination, because of fear of not being safe, of being misgendered, et cetera, et cetera. So there's a lot of health disparities that come with those issues. So I just wanted to add that.
Oh, thank you for that.
And then to go back to your question, how do you go from the interpersonal experience to translating that to activism and really kind of working with the community? I think that it's clear to Brown and Black folks and BIPOC and QCPOC folks that if we don't do it for us, nobody will. And that's where it is, right? We've all had our own experiences, regardless of race, ethnicity, that have made it very clear that there are systematic barriers for us to even attain equity in any way, right? If you're thinking about a racetrack, right? Like, how they assembled runners sort of at different stages, right, of the racetrack. But the one that's at the very far end, who's starting at the very far end, may have a shorter line around the curve, right? And why is that? Why do they assemble folks like that? Because that's what creates equity for all those runners that are trying to get to the end. And we realize the world that we live in doesn't work that way. We're not arranged in the closest end of the racetrack just because we're brown or Black or part of the or any other racial or ethnicity. So we got to do it for us, and that's where that transition happens, right? You see your community hurting, and your call to action. You've experienced it yourself, and you start moving from understanding your own privilege, your own experience, to realizing that you need to help other folks that are going through the same thing. And that's the process. Some folks are able to find those avenues or are lucky enough to make it that way. Some folks are not, right? I can just speak for myself. I was lucky enough to have some tools that allowed me to advocate for myself and the tenacity and the resilience to go after it, right? And that's all I can say about that.
We have a viewer who's saying, Jill, her name is South Central PA. She's from South Central Pennsylvania. And she's saying, we need help. Thank you for bringing this to light. Also a question from Donna in the audience. How about employers who deny benefits to folks who have to identify as male, female, and seek coverage for non-traditional male-female medical issues? An example, a trans man who has to see a gynecologist for a regular checkup. So Carter, you have some thoughts on that, Donna's question. Oh, you're on mute, Carter. Sorry.
Yeah, I just read that. I thought Donna was just presenting another example to add to that conversation. But yeah, it's ridiculous. I unfortunately I can't speak much to that issue. I know that at the LGBT Center we have inclusive benefits. You know what I mean? And I know that it's rare, it's incredible, and it is what every institution and business should have. Those
is there a big push for that right now for inclusive health benefits? And I'm not, I haven't paid too much attention to that, but what's that push like right now? I'm real curious about the policy dimensions of that.
No, I'm sure. I mean, that's something that my executive director would probably know way more about than I would, but I'm absolutely sure there's a push for that. Like you need, affirming healthcare. They're not getting it, but they're working just like everyone else. So it does not make much sense. It's not fair. But those are the type of issues that we need to be contacting our legislators about, and people need to be actively working towards getting that addressed.
Speaking of legislators too, what's that been like? As we're having more discussions about the LGBTQ community. We're being more not just aware of those issues, but more empathetic to that plight, to that cause, right? And I wonder, so a really important issue like inclusive healthcare benefits, that's a major policy issue. So two-part question here. One, I wonder, what are those kind of standout policy issues for your community or for, and well, more specifically for Black LGBTQ, brown LGBTQ, Indigenous, other people of color? What are those policy issues that stand out? And what kind of responses do you feel like you're getting from policymakers on this? Go ahead, Carter, you can continue with that.
Sure. We just had a visit the other day from some people that were representing the ACLU. And they came and talked to some of our young people. Our youth leadership is called the Youth Advisory Board, right? And they make a lot of decisions as to what should and should not be happening at GLOW. They're representatives of the population that we're serving, and we really value their input. But during that meeting, they were talking about the importance of young people, specifically Black and brown LGBTQ plus people, learning how to tell their story, craft their story, and share it in a way that can be used as a tool for advocacy. So there are trainings that exist that honestly I did not know existed, but there are these trainings that exist for young people to be able to go out, tell their stories, and actively affect change in a way that I think a lot of us were unfamiliar with. You do not have to be a lawmaker. These young people are being trained to actually use their voice and their stories to make something happen.
Yeah, that sounds exciting. That's up my wheelhouse. Like I always love to see like young people getting involved like that, but also young people, organizations and movements being intentional about like what you just said about that youth advisory board. You didn't say they were just involved or like we get their input. You were like making decisions. Like that's especially important, making young people feel like they have ownership, that they're the actual leaders in that. Bryce, your thoughts on that too, those specific policy issues which are unique, you feel, to your community, to Black LGBTQ, right? and what the response is like, what sort of movement is needed or is happening on those issues.
Yeah, most definitely. So the biggest push that I find is the push of we don't need to have for trans individuals. Those individuals don't need to have a diagnosis of gender dysphoria to be able to receive HRT, hormone replacement therapy. The majority of individuals who are transgender don't have gender dysphoria, especially for a lot of our youth who are coming out nowadays who have parents who know about the transgender community and the LGBTQ plus community, and are allowing those kids to be who they want to be. So that's one of the biggest pushes that I'm aware of. The other biggest thing that I know that I've continuously asked for and tirelessly asked for over the last 2 years that I've worked at Keystone has been a change in the forms that we have. Why don't we have gender on the forms instead of sex? Why are we not collecting more pronouns than just one specific sex? And, I brought up to them, I don't fit in here. I'm not, my gender, it doesn't matter. And so what are we going to do about that? Nothing's done about that yet. So that kind of tells you how, obviously, we have a diversity and inclusion board, a diversity and inclusion committee, but that's just starting. So slowly chipping away, but how long will it take?
So yeah. Stephen, your thoughts on that too, like those policy issues that for you are like front and center that are being focused on and need to be focused on.
Healthcare is overwhelmingly the biggest need in our community. Just want to mention a couple things that Bradbury Sullivan LGBT Community Center is doing. So every 2 years, we administer a statewide health needs assessment for the LGBTQ community. And it sheds a lot of light on what our community needs right now. And overwhelmingly, you see that mental health is a major concern, even more for people of color within the LGBTQ community. So there are a number of health disparities that we're seeing that make it more difficult for people to get the care that they need. We just finished administering a state level vaccine hesitancy survey for LGBTQ Pennsylvanians. And we're seeing that the majority of LGBTQ Pennsylvanians do want the vaccine. The problem is that there are barriers to care that are limiting their ability to do so. And when you look at the Black community within the LGBTQ Pennsylvanian community, they are more hesitant to get the vaccine, and they are getting the vaccine at slower rates. So one of the recommendations that we have is that public health professionals and healthcare providers come up with a strategic plan to reach Black LGBTQ Pennsylvanians, because we know that even though President Biden has said, if you're fully vaccinated, you can take off your mask, getting to that point is more difficult for Black LGBTQ Pennsylvanians. So, filling in the gaps where needed is really important as well.
Yeah. I did notice that everyone, that's a common theme here in this conversation about healthcare and that being a big priority. Anna, I would love to get your thoughts on something else that Carter was saying earlier when you were talking about Central PA, Carter, and about Harrisburg, about homelessness is real serious. And I know in Florida, has one of the highest homelessness rates in the country when you compare states. I mean, I think Florida's in the top 5 as far as rates of homelessness. And so I wonder about that intersection of homelessness and also dealing with being LGBTQ and being a person of color, being Black, brown, or indigenous, and how that's managed in a place like Florida. Anna?
Oh my goodness, that's a big question. Well, I mean, I can't speak specifically to how that's being managed in Florida because as part of what I do, we work at the national level. And so we work with many centers like Carter's and Stevens to really uplift and support and connect the work that they do. So I'm not necessarily working at the local level in Florida. I'm working with centers that are working at the local level. Homelessness is an issue, especially within the youth population across the nation. and within the LGBTQ community, even more, like Carter mentioned in the past, especially for brown and Black folks, we're dealing with families that are like, pick your issue. And if not, leave the house. And they got nowhere else to turn to, right?
Yeah.
Where are they going? To these community organizations that are serving them, that are providing the essential services like housing, right? Like food pantries, like clothing, and just overall, just a safe space for them to be at. So this is literally the safe haven for youth that are experiencing homelessness and that are LGBTQ. It's these community centers that continue to provide life-saving services across the nation. And what we do to support that as CenterLink is really to provide them with programmatic resources, with financial resources, re-granting, and then one of the things that we were just talking about was policy. One of our programmatic arms to our organization called ActionLink, which is really has been put together to kind of gather the policy needs of these LGBTQ serving organizations to create a national voice and a statewide voice as well. So to connect those centers, those organizations, and to give them tools to advocate for themselves at the state and national level.
I'm just having a difficult time just sort of visualize as a parent, how a parent can kick their child out of a household just because they happen to be different from. I'm having a hard time visualizing that, and I don't know. I understand how homelessness of your child makes that situation better.
Charles, I have to let you know, 40, of the homeless youth that are throughout the nation, 40% of them are LGBTQ.
I didn't know that.
40%.
I did not know that. All right. I'm having a hard time. I'm sorry. I'm just having a hard time. See, I'm sorry. I can't imagine that, like being a parent doing that. I just and thinking that that's going to make the situation better. We're going to just real quick. You're joining us for. I'm sorry. I'm just because I am a parent. I'm just like I just can't imagine that. The homelessness piece of it is really something that just thinking about it even affects me. We're here on Toward Racial Justice. I'm Charles Ellison. You can send comments to discuss at WITF.org and also hashtag racial justice PA. We also have, if you feel like if you want to join in on the conversation, I do see a couple of comments we have received, and I do appreciate that from viewers, from listeners. And once again, you can do that on social media as well at hashtag racial justice PA. We did get a comment from Marilyn. Marilyn says, Marilyn is a recovering Catholic, now Lutheran. I've discovered that my Lutheran congregation is not a member of the ELCA, Evangelical Lutheran Church of America, a voluntary membership, put air quotes around membership, of Lutheran congregations and organizations who support full advocacy for LGBTQ plus rights. Having heard your conversation around religion-driven conversion therapy has put the nail in the coffin of my membership and tithing to my congregation. So that's Marilyn right there. Terry also chimes in and says, advocacy efforts to pass the Equality Act are underway. I know SAGE, and I'm not familiar with SAGE, SAGE, is doing a lot of work to contact Pennsylvania lawmakers. I don't know, what is SAGE? I'm just enlightened.
They're based out of New York, so they work with older LGBTQ Americans.
Okay, got it. What's that stand for again? SAGE? Do we know? No, that's okay. Don't worry about it. I'll find out in a minute because I tend to multitask sometimes, and I'll just like do a little quick search on that. Anyone would want to sort of give any thoughts on those advocacy efforts? I don't know, Carter, about like the Equality Act. Are you familiar with that or involved with that in any way? Either you, Carter. Oh, Stephen, go ahead. You raised your hand.
Sure. So the Equality Act is something that we are persistent about. We know that it is the legislation that we need at the federal level to make sweeping change, not only across the country, but here in Pennsylvania. You know, we have a patchwork of protections here in Pennsylvania. You could, you know, drive from one city to the next and your protections could be taken away from you because there's just no consistency across the board. So our organization, Bradbury Sullivan LGBT Community Center, has been working really hard trying to get you know, support from community stakeholders from various backgrounds to really urge Senator Pat Toomey in particular for his vote, because we know that the House passed it. It's all in the Senate now. We know that Senator Casey said he would support it. So we're really urging Senator Toomey to support this because given the you know, the shakeup of the Senate, you know, it could be a very close vote. So every vote counts. So we're working really closely with faith organizers. It's Military Appreciation Month, so we just posted some op-eds from local veterans, just trying to get the word out in any way possible because we know that this is something that's really important. We know that Harrisburg lawmakers were also trying to establish something like that, but it got shot down. So we're really hoping that, you know, the Equality Act will once and for all just kind of make everyone feel protected in one way or another.
Thanks to, SAGE, by the way, stands for Services and Advocacy for GLBT Elders. Got it. So thank you. Just want to thank one of our producers of the Tour Racial Justice Series. Thank you, Lisa. Appreciate that. And, you know, I'm real curious too, as it's fascinating discussion, and you know, before we run out of time, but I wonder about the generational aspects of it, right? Like, so just like it is with, you know, me being, you know, growing up in North Philly, being a Black man, being also Black biracial man as well. You know, I'm Gen X, and it was very difficult growing up biracial, growing up Black and biracial in Black North Philly back then, 70s, 80s. It was very different experience back then compared to now, where it's a commonly accepted thing. I sense the same thing. Is that correct? I mean, as far as the LGBTQ community is concerned, but there are some generational struggles as well, right? I mean, I know that like elder LGBTQ folks tend to see that, you know, the younger generation has it pretty good. And but what are those generational conversations like, you know, as and what are those tensions like? I wonder about that. Bryce, you want to jump in on that?
Yeah, sure. So things are better.
Okay.
But we just had there was a story about a 16-year-old non-binary individual who was Black, who was hung up. She was so it's things are better.
Okay.
They're not perfect, but I think that in general, we have a better understanding about the LGBTQ community. We're here having a conversation with it on WITF, which, you know, would we be having this conversation maybe 20 years ago on a radio station like this?
Probably not.
Probably not, you know, or unless we were all here as goofy drag queens, you know, because that was the craze back then. Transsexuals, drag queens, are they men, are they women, da da da. But there's no real serious conversations about it back then. So things are getting better. We have more resources, but ultimately we need to have something from the federal level, as Stephen was talking about, such as the Equality Act. Here in Chambersburg, I don't have protections whatsoever for housing, for my job, or anything like that. I don't have protections whatsoever. So if they wanted to fire me because I'm queer, they could, and there would be no problem with it. So having something across the board, like right now we're advocating for a non-discrimination ordinance. And yes, thank you. Michaela Miller was the non-binary individual's name. So we're advocating. People, it sometimes feels like it's falling on deaf ears because people will say, well, we're not experts in this. What do we need this for? We already passed, you know, a change in our policy. So why do we need to have a specific law? If people who are being oppressed are telling you, this is the way that you're oppressing me, and this is what can be done to fix that problem, please take them seriously. And that's what I was on that.
That's an interesting point, Bryce. It raises a question. Do you feel like the pop culture aspect of the conversation around pop culture acceptance of the LGBTQ community. People thinking, oh, everything's fine because they see now LGBTQ characters, shows, cartoons, right? And so they're thinking everything is rosy, but it sort of blinds people to the real challenges, the real policy issues that you all are going through. Carter, if you want to reflect on that, and I'll go around the table on it. Carter. Oh, you're on mute.
The second time I did that.
Sorry, don't worry about it.
Want me to speak to that visibility piece or to the generational?
You could speak to both, actually, because I think they're both related.
Sure. Yeah. I mean, as far as the generational divide goes, I think Generation Z, is that the new kid? Yeah.
Generation Z, right. Yeah, the millennials got old.
Yeah, I'm the oldest millennial. I
right.
think that,
I have millennial daughters. Yeah, so yeah I hear you.
I think that Generation Z is the difference between them and previous generations is that they're more accepting of who they are. Like they've been allowed to be themselves in a way that previous generations haven't. And I think they're also significantly more empowered at a young age than a lot of us were, because if there is support that they seek at home and don't receive, they have access to the internet. They have all types of support. They've established electronic families and friend groups. They've been able to educate themselves on issues and speak about it intelligently. So I think Generation Z is a powerful group of people.
I think so too.
Yeah. And as far as like visibility goes, I know I feel the exact same way that you do, Charles. I think it is super dangerous to associate like queer, Black, or, LGBTQ plus people of color on TV and in media with some sort of progress. Like I see no correlation there. I think that seeing us on TV, seeing our communities represented is awesome. It's great. It's cute, but it doesn't change our material circumstances. It doesn't change the fact that we are more likely to be disproportionately incarcerated, killed by police, impoverished. It changes nothing. So like we need a real structural change. That whole idea, like we're seen in Pose and RuPaul's Drag Race. I think it's awesome, but I don't think it says much about change at all.
Yeah, it's the same thing with conversations around race and racism. I don't want to have conversations on race so much or how we get along. I want to have a conversation about racism, and how do we eliminate it? That's where it gets more uncomfortable. But Anna, I noticed you were coming off mute as if you were about to say something. You want to jump in on that conversation? You were itching.
I just loved. I love what Carter said. In this day and age where we're having these conversations so much, and all organizations are worried about their diversity, equity, and inclusion, and the face value of that. Right? Representation really means nothing if it's not coupled with true inclusion and commitment to action. So you can turn in a social media post that has a Black and brown face on it, but if I go to your offices and the treatment that you're giving your employees that are Black, brown, LGBTQ don't match up with that external face you're giving to the public, what does that mean? It means nothing, right? And that's really where we need to start. Before you put a social media, before you put these folks on TV, what is your institutional commitment to these folks?
You have inclusive healthcare, for example.
Exactly. And what's your treatment to your employees, right? Or are you tokenizing them? Are you asking them that they do everything and they reach out to their Black and brown folks? Or are you helping them, right? Are you supporting them? Are you uplifting them? That's where the conversation needs to be.
Stephen, is that? Oh, go ahead, Bryce.
Can I jump in real quick and just say, yes, very much so. And I don't want to, I'll just say, I am sick and tired of seeing diversity, equity, and inclusion committees at these organizations with white individuals as the chair and co-chair of the Diversity, Equity, and Inclusion Committee. heterosexual, white individuals, thank you so much for your allyship, but we need to be in those seats.
Right.
That's all I want to say.
Yeah.
That's all I'm
And
saying.
Stephen, go ahead, jump in on the conversation too. And is that like, talk about also Anna said something about the tokenization. So that's something that, obviously clearly communities of color, Black people, brown people dealt with for a long time, for generations, but talk about it in the context of the LGBTQ community, particularly the BIPOC LGBTQ community.
So we need to be at the table, like just plain and simple. It's really important to do that. I think sometimes it's more difficult in areas where, we're not as predominant. So I'm grateful that I'm part of the leadership of Bradbury Sullivan LGBT Community Center. If you look at our bios in our team, it is predominantly white, but it's important that those white colleagues are true allies and elevate and encourage their employees of color to be at the table when important conversations are happening. When we heard about Dante Wright, when we heard about Adam Toledo, we immediately thought of what can we do that's proactive and not reactive? How do we show true allyship in this moment? When the attack with Asians in Atlanta happened, what can we do? So I volunteered myself, even though it's not my specific Asian community, I felt that having me as a face to really put a face on this issue, because I think you can see the headlines and just assume things, but once you really connect with an actual message, it resonates more. So it's those simple things that we can do in our communities to, even if the seats aren't there at the table, we really need to count on our white brothers and sisters and siblings to be true allies until the point where we have true representation at the table.
All right, Stephen, you'll get the last word. Thank you. So we ran out of time, unfortunately. We need to do a part 2 of this conversation, but in the meantime, just definitely a lot there. Some of the other questions I have as well, so I'm hoping we can bring you all back. So I want to thank you all. That was Stephen Jiwanmal, who is communications manager for the Bradbury Sullivan LGBT Community Center in Allentown, Pennsylvania. Also, Bryce Williams before him, medical case manager at Keystone Rural Health Center. We also are joined by Ana Machado, who is in Florida. She's director of programs at Centerlink, the community of LGBT centers in Orlando, Florida, and Amanda Carter, site director, Glow Harrisburg LGBT Center of Central Pennsylvania in Harrisburg. Thank you all. Really appreciate this. It's a very enlightening discussion. So, I felt like we needed more time, but we'll find it. We'll do a part 2 for sure. So I really appreciate this, and I appreciate everyone else who's been watching us and listening. And a reminder that the entire Toward Racial Justice series is available to watch, listen, and share on demand. Visit witf.org/racial justice to access past conversations, including this one right here, and find additional resources. This has been Toward Racial Justice. I'm Charles Ellison. Before we close for the evening, don't forget the YWCA Racial Equity Challenge. A reminder that YWCA organizations across Pennsylvania are participating in a 21-day racial equity and social justice challenge as part of a national movement to engage communities in anti-racist work. You can sign up to receive daily emails with a roundup of resources, listen to podcasts, read articles, watch videos, or learn ways to reflect on your own personal experiences. Visit, once again, witf.org/racial justice to learn more and sign up for a challenge near you. Coming up next time, May 25th marks the 1-year anniversary of George Floyd's death while in police custody, initiating a year of civil unrest and protest across the nation. Can't forget about that. The impact of his killing forged the path for not only our entire Toward Racial Justice series, but a powerful shift in how our country navigates racism. Join Toward Racial Justice Thursday, May 27th at 7 p.m. as we hear from individuals working to establish criminal justice reform in the mid-state, as well as experts that will analyze how George Floyd's death sparked a new generation of activists and where we go from here. That's Thursday, May 27th at 7 p.m. live on WITF's YouTube channel and Facebook page. So you want to register to attend at witf.org/racial justice. I want to thank our panelists once again. I'm Charles Ellison of WURD's Reality Check Daily Public Affairs on the home of Black Talk Media. That's 10 a.m. every Eastern time, every Monday through Thursday. You can reach me at Ellison Report on Twitter.com. In the meantime, everyone, goodbye, good night, and please, everyone, stay well and be safe.